We are still here, co-developing a guide to the menopause for women living with HIV. We Are Still Here is based on a collaboration between the Sophia Forum and Dr. Jackie Stevenson, who carried out research exploring women's experiences of ageing with HIV in London. Using participatory and creative methods, Dr. Stevenson involved women living with HIV in each stage of the research, adopting an advocacy approach to generate new evidence on the experiences of women ageing with HIV. There is evidence that women living with HIV may start the menopause earlier and experience more severe menopause symptoms. Older women have reported feeling excluded by support services and lacking access to information about the menopause living with HIV. This can lead to negative health outcomes and delay in accessing care for menopause symptoms. Our aim was to create a guide for women living with HIV to improve outcomes. Sophia Forum used our long-standing Wise Up methodology developed by and for women living with HIV, creating communities of women living with HIV, building advocacy skills and peer support to run a weekend workshop on ageing with HIV. During one of our workshops, we ran an interactive update session ran by researchers and a clinician specialising in HIV and the menopause that enabled women to ask questions relating to this subject and what they would like to see in a resource. A particular learning and shared outcome from this session was the challenge women face in accessing accurate, up-to-date and personalised information on menopause and HIV. Many women felt that both the GP and HIV consultant lacked comprehensive information and described being sent back and forth between primary care and the HIV clinic. The We Are Still Here campaign was co-developed with participants at this workshop, who developed advocacy priorities and key asks based on their own experiences in the research. In small groups, participants discussed changes they most wanted to see, which would benefit older women living with HIV. These priorities were fed back to the whole group, who shared priorities, resulting in 8 key advocacy asks. Advocacy ask number 2 was for accurate, accessible and comprehensive menopause information and support in HIV clinics. We collaborated with Newson Health Research and Education in co-creating this guide, which was printed in 2020 both online and in printed versions. Our next slide shows the front cover of the menopause guide itself, which was designed by Jane Shepherd, a woman living with HIV. The workshop was attended by 23 women. Topics highlighted ranged from health risks related to the menopause, treatment, including HRT treatment, and sex and relationships as important. In the development of a resource, women requested a simple, engaging question and answer format. Women reported after reading it they felt included, able to have informed conversations, and comfortable asking about support with symptoms relating to the menopause. Demand for this guide has been high. It is available throughout the UK and has been translated into Russian, Portuguese, Hindi, Bengali and Urdu. And we are keen to collaborate with other organisations to support further translation so that we can reach as many women as possible globally with this resource, giving them access to this information. Our unique guide allows women living with HIV to learn about the menopause, empowering them to interact with the healthcare system confidently and improve their well-being. As a result, they are a valuable template for engagement of menopausal women with health conditions. We'd like to say a big thank you to all the women who attended our Wise Up weekend, whose experiences and voices have informed the creation of this resource.